There's a federal program right now that will pay almost all of your prescription drug costs for the rest of your life. The government estimates over 3 million people qualify for it and never sign up. They miss out on around $5,000 a year, every single year, for the rest of their life. I'm Andy Childs. I'm a Medicare broker in Mesa, Arizona. I started this when I was 20, and I've been doing it for 7 years now. And in this video, I'm going to show you exactly what this program is, who qualifies for it in 2026, and the one form that gets people approved in 15 minutes that almost nobody knows exists. Stay with me, because if you're watching this for a parent or for yourself, the next 10 minutes are worth somewhere between $3,000 and $6,000 a year. Here's what every other video about this program gets wrong. They tell you it's for low-income seniors. They show you the income chart and they move on. What they don't tell you is this: the rules changed in 2024. The Inflation Reduction Act blew up the old partial extra help tier and replaced it with one full benefit for everyone under the threshold. So a lot of people who were told you don't qualify 3 or 4 years ago under the old rules qualify for the full benefits today, and nobody's told them. I'm not just going to show you the brackets. I'm going to show you the 3 doors into this program, because most people only know about one of them, and it's the slowest one. Let me paint you the picture this video is solving. You're on Medicare. You're on a fixed income, maybe Social Security plus a small pension, maybe just Social Security. You go to the pharmacy and you pick up your medications. One of them is for blood pressure, that's $9. The next one's for diabetes, that one's $42. The third one, the one the doctor just put you on, that one's $280 a month. You stand at the counter and you do the math in your head. And you start thinking about which one you can skip this month. That's the situation millions of people on Medicare are in right now. And the cruel part of it, the part that should make every one of us a little angry, is that the program designed to fix exactly this is sitting right there. The application takes about 15 minutes. The approval comes in the mail. And the savings start the next month. The program is called Extra Help. It's called the Low-Income Subsidy, or LIS. Same thing, different names. And in this video, I'm going to make sure you walk away knowing whether you qualify, how to apply, and what to do if you've been told no in the past, because that no might not be a no anymore. Let's get into it. The first thing nobody explains clearly is what this program actually does. So let me break it down. When you have Medicare Part D, that's the prescription drug coverage, you pay for your medications in 5 layers. There's the monthly premium, an annual deductible, there's the copay or coinsurance every time you fill a prescription, there's the coverage gap, and yes, that still exists in 2026, it's just in a different form. And then there's the catastrophic threshold, once you spent enough out of pocket. Extra Help reaches into every one of those layers and either eliminates it or puts a cap on it. I'm going to draw this out so you can see it. 5 horizontal bars stacked from top to bottom. The top one, monthly premium. Without Extra Help, that's anywhere from $20 to $70 a month, depending on the plan you pick. With Extra Help on a benchmark plan in Arizona, that's $0. Bar 2, the annual deductible. In 2026, the standard Part D deductible is around $590. Without Extra Help, that's the first $590 you pay before coverage kicks in. With Extra Help, $0. Bar 3 is the copays. This is where people feel the most pain. Without Extra Help, you might be paying $40, $60, $200 per medication. Bar 4, the coverage gap. There used to be this brutal donut hole where your costs went up dramatically. With Extra Help, there is no donut hole. You stay on the 5 and 12 cap. And bar 5 is the catastrophic level. The 2026 out-of-pocket cap for everyone is $2,100. So when you add it all up, premiums gone, deductible gone, copays at 5 and 12, no donut hole, $0 after the cap. For somebody taking 3 or 4 medications, this program saves them between $3,000 and $6,000 a year. Some people more. That's not a discount, that's a different reality. Now let's talk about who actually qualifies. Here's where most videos lose people. They show you one income chart. They say you're under it or you're not. That is not how this program actually works. There are 3 different doors into extra help, and you only need one of them to open. Door 1, auto enrollment. If you have Medicare and Medicaid at the same time, what we call dual eligible, what we covered in video 8, you are automatically in extra help. You don't apply, the government enrolls you. Same thing if you have SSI, and same thing if you're enrolled in a Medicare savings program. Door 2, income and asset test. This is where most people sit. For 2026, you qualify if your annual income is under 150% of the federal poverty level. For a single person, that's $23,475. And for a married couple, it's roughly $31,725. And there's an asset test, about $17,600 for a single person and $35,130 for a couple. Those numbers slightly shift each year. And door 3 is application through Social Security. If you're not auto-enrolled and you're under the income line, you'll fill out a form called the SSA 1020 online, by phone, or on paper. Here's the part nobody tells you. You only need one door. If you walk through door 1, you don't have to apply for door 3. If you got told no 5 years ago because of the old asset rules, those rules were liberalized. Reapply. The application takes 15 minutes. Imagine for a minute you're a widow in Mesa, age 72. Social Security is $21,000 a year. You have $8,000 in your savings account. You've been told for years that extra help is for people with no money, and you've never applied. Under the 2026 rules, you walk through door 2 without breaking a sweat. You'd be saving $4,000 a year, and you have no idea. That's the conversation I'm trying to start with this video. Recheck the doors because they've moved. So you've decided to apply door 3, the SSA 1020. Let me walk you through exactly how this works, because there's 3 mistakes that get good applications denied, and one of them is so common, it's almost the default mistake. Here are the 4 steps to apply. First, SSA 1020 form. You could do it 3 ways: online, on the phone, or a paper application. All 3 submit to the same place, and the fastest is online. It takes about 15 minutes. Step 2, you get an approval letter. It comes by the mail in about 2 to 4 weeks. The letter says you qualify, and it includes a Medicare drug plan they enrolled you in automatically, but it might not be the right plan for your medications. Step 3, pick the Part D plan that actually fits your medications. This is where I come in. Once you have extra help approved, we shop the Part D plans in your zip code, plug your medications into the formulary, and pick the plan that gives you the lowest copays on your specific drug lists. The auto-enroll plan is rarely the best one. And step 4 is reevaluation. Social Security rechecks your eligibility every year. If your income changes or if you inherit money, they will recheck. Now the 3 mistakes. Mistake number 1, and this is the most common one. People undervalue their assets and then panic. They count their checking account, their savings, and their car. They forget your house doesn't count. Your car doesn't count. Your burial fund up to $1,500 doesn't count. Your life insurance up to $1,500 cash value doesn't count. Personal possessions don't count. People look at the asset chart, see that they have $19,000 in a 401k, and self-disqualify. Then they don't even apply. They were probably eligible, so apply anyways. The form figures it out. Mistake number 2, they assume Medicaid is a separate process, but it's not necessarily. In Arizona, we have access. If you qualify for access, you walk through door 1 and extra help is automatic. If you've been told you might qualify for access, but you've been dragging your feet on it, that one form opens both doors at once. Mistake number 3, and this one breaks my heart. People get approved for extra help and stay on whatever Part D plan they were already on. It's a big mistake. Once you have extra help, you have a special enrollment period that lets you change your plan once per quarter. That's 4 chances a year to land on the plan that handles your specific medications best. Most people don't know they have this, and they leave money on the table for years. If you got hit by any of those 3, there's a fix for all 3. Let's do a quick recap so you could hold on to this. Extra Help is the federal program that almost eliminates Part D costs for people under 150% of the federal poverty level. Premium gone. Deductible gone. Copays capped at $5 for generics, $12 for brand names. No donut hole, $0 after the out-of-pocket cap. 3 doors into it. Door 1, automatic if you have Medicare plus Medicaid, SSI, or a Medicare savings program. Door 2, under the 2026 income and assets thresholds. Door 3, the SSA 1020 application. It's online or by phone, 15 minutes. And once you're in Part D, make sure you change your plan to fit your actual medications. Don't stay on the auto-assigned one. If you watched this and thought, that might be me, or might be my dad or my mom, comment the word Extra Help below this video. Or you could hit the link in the description for a free consult. Working with me costs you nothing. The carriers compensate brokers directly. I do not get paid more or less based on which Part D plan you end up on. So the only thing that I'm optimizing for you is your medication list and your wallet. And subscribe. I drop 2 of these videos every week. And there's no faster way to learn this stuff than just keeping the channel in your feed.